Hi, welcome back to the channel. Hope you're having a great day today. Let's talk about beard transplants. Very, very common topic these days. We are doing a lot of beard transplants now that it's becoming more out there in the media. Patients are coming to us to fill in little gaps in their face, to fill in the mustache, filling in scars that they had from before, from trauma or surgery. So beard transplants are great. They're very cool. I love doing them. Technically, they're a little bit challenging for us, but they provide great results when they're done correctly. Patients have a lot more flexibility, and they tend to love it. Coincidentally, I'm sure he won't mind me saying that, I did a beard transplant in my son, Bruno. He's 25 now. I did a transplant on him about 4 months ago, so we filled in the cheeks here, filled in a little bit under the lip, and he's about 4 months of growth now. I wish I had pictures to show you from him. Hopefully next time I'll do that, but it just didn't occur to me. But he's growing really well and it's looking good. So beard hair transplant, normally if it's a large area of the beard, we use the same scalp hair that we would use for a scalp transplant. The scalp hair matches really well the beard hair, even though hair in the beard is a little coarser, a little bit thicker in diameter than the scalp, but once you put them together, they blend well. Plus the scalp hair grows long, so if you are someone who wants to grow a little bit more longer, fuller beard, you'll be able to do that as well. The procedure is all done under local anesthesia, very comfortable. I have all the anesthesia tricks to do nerve blocks, so you don't feel any pain. After the surgery, the recovery is very fast. The face heals really quickly. You're talking maybe 2 or 3 days before the little scabs here start to break apart. And so you don't need to be in the hospital for this at all. It's all done in the office, and the results can be pretty amazing. So if you're interested in something like this, either if you have a little patchy area, you want to pick it up some more, or you just don't grow a lot of beard and you want to improve that, I can give you some tips. Just call us for a free consultation. We'll give you the phone number at the end. But first I want to show you a case here just to see what we can do, what can be done with a beard transplant. So let me show you a little bit of an example here of what we can do with beard transplants. This is a gentleman that came to me a while back. He was getting married after a few months, and he just wanted to sort of thicken up this area here around the mouth. You can see this is before the surgery. I already marked the areas, so we wanted to connect a little bit here, the mustache with the side of the sideburn or the goatee. Sorry. Also elevate the line of the goatee here, increase the density under the lip around here a little bit. His mustache he was okay with, although there's a little bit less density there. But then do the same thing on this side. These two areas he didn't really care for. Most people have a little bit of a thin spot there, so we left it alone. Some patients decide to go all the way and cover under the lip too. It's a preference. So with that said, we set out to do, fill in here, fill in a little bit of his cheeks and also down here. And this is the results here after a year of the procedure. So you can see how everything looks much thicker, much fuller. The mustache, we didn't really do much with it, but with a little bit of Rogaine that we recommend to him, it can grow a little bit thicker. But you can see here the density of hair along these areas. It's much better. You can still see through a little bit of the skin, but that's not what a natural beard is. If you wanted more density, we could go and add more hair. Under the lip here, you can see also how it comes really naturally. There's no scarrings that show. Everything is irregular, so if he wants to trim these hairs here and make it real nice and straight, he can get a straight razor and do that. So you can see the connections here are much stronger. So overall, very nice result. On the goatee area, that's a little bit of the more challenging area is the goatee area, because you have the hair has to go in a very shallow angle so it won't stick out. Another area that's tricky too, and I've seen patients where their hairs were placed incorrectly, is here coming from the sideburns into the beard. There is a turn of the hair normally. Some patients actually make a whirl and the hair actually goes back towards the back. Very important to follow the natural direction of the patient. You don't want to create anything that's not there. I have seen patients where the hairs were placed in an angle like that, so it wouldn't look natural anyway. Some of them, the hair were placed going downward, going backwards. Those are not perfect ways to put the beard there. So it requires experience, it requires an artistic view, it requires a great team. I'm fortunate enough that we have everything here, all the check marks we have in our office. So your experience should be painless, and your recovery should be quick, and the results should be very nice, and you should be very happy. So that's what we can achieve with a beard transplant. Thank you. So as you see, beard transplants can be very natural. It's important to follow angle and direction very well, but that's my job. You don't have to worry about that. We have a lot of experience in that regard. All you have to do is relax. So if this is something that if you think it can benefit you, give us a call. We offer free consultations. The number is here below, and I'll be happy to see you virtually or even in person too, even with the COVID precautions that we have, so we can draw up a plan for you and get you the rest of the way. I look forward to seeing you soon. Take care.